Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is carpal bones. So today we will discuss about the carpal bones. Okay. So let us introduce first. We have total 8 carpal bones in a hand, and in the two hands there is 8 into 2, so 16 total carpal bones in the human body, and in one hand there is only 8 carpal bones, which is arranged in two rows. One is proximal and one is distal. Now, it is so much important for the wrist movement and the stability. So, what we have discussed till now, there are total 8 carpal bones present in a single hand, and there is present of 16 total carpal bones in the human body, and which is arranged in two rows. One is proximal and one is distal, and it is an important for wrist movement and stability. Now we have a mnemonic for this remembrance of this bone name. So what is the mnemonic? That is, Sita looks too pretty, try to catch her. We will take the first alphabet of these all, like Sita S, looks L, to T, pretty P, try T, to T, catch C, her H. And the bone are named according to proximal to distal and lateral to medial. So in the proximal row, first bone is scaphoid, then lunate, then triquetral, then pisiform. And in the distal row, trapezium, trapezoid, capitate, hamate. So what are the 8 bones from in the proximal row? Scaphoid, lunate, triquetral, pisiform. Distal row, trapezium, trapezoid, capitate, hamate. Now, in details, proximal row. First bone is scaphoid, which is boat shaped and it is most commonly fractured. Then the lunate, which is moon shaped, commonly dislocated. Then triquetrum, which is pyramid shaped and it articulates with pisiform. Then pisiform, it is a sesamoid bone in flexor carpi ulnaris tendon. And in the distal row, first one is trapezium, which articulates with the thumb, like first metacarpal. Then trapezoid, which is the smallest bone in the distal row. Then capitate, that is the largest carpal bone. Then hamate, has a hook or hamulus, and it ulnar nerves runs nearby. So boat-shaped bone, scaphoid, moon-shaped bone, lunate, pyramid-shaped bone, triquetrum. Which is the bone that is commonly dislocated? That is lunate. Which is most commonly fractured? Scaphoid. Which is the sesamoid bone present in the carpal bone? That is pisiform. Then now next question, which one is the largest carpal bone? That is capitate. The smallest carpal bone in the distal row, trapezoid. Then hamate, it is a hook. It has a hook. So first one scaphoid, which is boat shaped, which is most commonly fractured. Second one lunate, which is moon shaped and commonly dislocated. Third one is triquetrum, which is pyramid shaped and articulates with the pisiform. Then pisiform, which is a sesamoid bone in flexor carpi ulnaris tendon. In the distal row, that is trapezium, which articulates with the thumb, which is first metacarpal. Then trapezoid, that is the smallest in the distal row. Then capate, which is the largest carpal bone, and in the last, that is hamate, it has a hook or hamulus, and ulnar nerve runs nearby of this bone. Then the articulation. Articulations are with radius, with ulna, and with the metacarpals. With radius, that is scaphoid and lunate. With the ulna, that is separated by TFCC, that is triangular fibrocartilage complex. With metacarpals, that is distal row bone. And blood supply and clinical importance. Scaphoid, it is a retrograde blood flow, risk of avascular necrosis. Then carpal tunnel syndrome, median nerve compression. Carpal tunnel syndrome is already discussed in a video, you can check that also. Fractures, scaphoid is the most common, can be missed on X-ray. And now we have the diagram. You can see First one is this is scaphoid, bone shaped. Then lunate, triquetrum. Then we have trapezium, trapezoid, capitate, hamate. We have all the bone, and in the here you can see also the pisiform bone. So these are the 8 bones present in our wrist. So if we remember one time more, then there are 8 carpal bones which is arranged in 2 rows, and it is very much important for wrist movement and stability. And in 2 rows, the one row is proximal and one row is distal. We have a mnemonic also. Sita looks too pretty, try to catch her. Then we have the names in the proximal row: scaphoid, lunate, triquetral, pisiform, and in the distal row, that is trapezium, trapezoid, capitate, and hamate. Then we have in the proximal row scaphoid, which is boat shaped and most commonly fractured, lunate, which is moon shaped and commonly dislocated, then triquetrum, that is pyramid shaped and articulates with the pisiform, then pisiform, which is a sesamoid bone in flexor carpi ulnaris muscle, ulnaris tendon. Then in a distal row, that is trapezium, articulates with the thumb, which is first metacarpal. Then trapezoid, that is the smallest in the distal row. Then capitate, which is the largest carpal bone. And then hamate has a hook or hamulus, and ulnar nerves runs nearby. Then we have discussed about the articulation with radius, scaphoid, and lunate, with ulna separated by TFCC, triangular fibrocartilage complex. Then with metacarpals, that is distal row bone, and then blood supply and the clinical importance. Scaphoid, that is retrograde blood flow risk of avascular necrosis. Then carpal tunnel syndrome, median nerve compression. Then fractures. Scaphoid is the most common and can be missed on X-ray. Then we have the diagram, that is you can see scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate, all the 8 bones you can see here, and also see the radius, ulna, and all the metacarpal bone also. So thank you so much for watching the entire video. Do like, share, and subscribe to my channel for supporting me and my channel. And if you have any query or any doubt, please comment down in the comment section. I will try to reply them all. And you can also comment down in the comment section in which topic you want the next video. So thank you so much for watching.